Okay, having a general understanding now of what performance medicine is, the logical follow-up would then be, what exactly are those subspecialties, sports medicine and performing arts medicine, and how are they similar and how are they different? We can look at them as being similar in two major areas, and one is in their foundation, and their foundation should be based on movement science. And movement science is an interdisciplinary training that looks at human movement in biomechanics and physiology, through nutrition, through the psychology components, all of those in an effort and with the goal in mind to help prevent injury or disease and to help excel human performance. In other words, the goals that these performers may have. A second area that they're probably most common is in the general categories used to describe what it is that they do, or their approach, meaning general category of physical therapy, a general category of training or nutrition or performance or sports psychology or performing arts psychology. One of the big differences in general terms is, now that we have these general categories, it's the details in which those categories are carried out. A quick example and a very general example would be that if you're working with an athlete in sports medicine that is a swimmer, you're going to be looking in terms of what strokes is that swimmer having to prepare for, what injury history does that performer have, what movement patterns have they developed, and you're going to address in those general categories very specifically towards what that swimmer's goals are, versus working with an instrumentalist or a dancer or a vocalist. You're going to be looking at their movement patterns within their craft. So you're not going to be treating the swimmer the same way you'd be treating a dancer, even though you're doing physical therapy or you're doing training with them. You have to take into account the exact goals and the movement and the performance that each one of those is trying to achieve.